about it. I put it in the link called Germs in the News, so you can read this article. I put the link to the LA Times online, so those of you who subscribe to the Times online, you can get to that, or maybe they will let guests come and read the news, I don't know. But you can certainly search the internet for it if you can't get into that. Okay. Any questions about the assignment over here? What are Koch's criteria? Koch, again, wants to establish that a particular germ causes a particular disease. This is called the germ theory of disease, and it's responsible for more benefit of medicine than anything else in the history of medicine. Before they had this idea, they would argue with Semmelweis, you know, the doctor's hands look pretty clean. Why make them wash them again? And Semmelweis says, because I can still smell something. It smells rotten. I want them to keep washing because they haven't cleared it up. Once you have the germ theory of disease, I mean, this is hard to believe. Can you kill somebody by touching them? People don't believe it. It just seems incredible. How could you kill somebody? How could something that's invisible kill a person? Right? It's invisible, but it's not unverifiable. They can be seen through a microscope, these germs that kill people. And you can transmit them from one person to another, from one patient to another, from a sick person to a healthy person. So he wants to establish a particular germ causes a particular disease, and the first thing begins with extract the germs from a diseased animal. The second step, so you extract the germs and identify them. Second step is get a pure culture. How did he do that? With a solid medium rather than a liquid medium. Is there something? You have a question? All right. Third criterion. What's the third criterion? No? What's the third criterion for Koch? First criterion is extract the germs. The second criterion is get a pure culture. Then the third criterion is cause the disease in a healthy animal. So you want to show that a single germ can cause the disease. The fourth criterion is show that you can extract the germs from the previously healthy animal that's now sick and show that it matches microscopically. And then repeat the process. So you should be able to go from one animal to another, causing the disease, extracting the germ, getting a pure culture, showing it's the same germ, and showing that that germ can kill animal after animal. And when you've done that, then you know what tuberculosis is. It's caused by a particular germ. You know what malaria is. It's caused by a particular germ. You know what streptococcus infection is. It's caused by a particular germ. You know what MRSA is. It's caused by a particular germ. You know what CRE is. It's caused by a particular germ. And once you know what these germs are, what can you do with it? You can diagnose reliably. You know how to treat in cases where you know what the treatment is, in case of where antibiotics work, or which antibiotic might work for this germ. You know how to prevent it. How does the germ get from person to person? Break up the transmission. So you can prevent it, you can cure it, and as they've discovered, vaccination might be useful. And these are the things, understanding to keep clean in surgery, clean the endoscope between patients, wash your hands between patients, break the transmission of germs, kill the insects that transmit malaria, clean the water if the water supply is polluted with cholera, clean the sewage, make sure the sewage doesn't get back into your water supply, because that's a sure way to give everybody cholera, as they did in London before the sewer systems were improved. Once you have the germ theory of disease, you know how to organize society so you can have millions of people. There weren't any cities in Europe with 1 million people. Once the Roman Empire fell, Rome had a population of 1.2 million people. How did they all live together? They had a proper sewer system. The Romans understood the sewage system. They had a proper water supply, bringing in clean water. The water supply and the sewage system were separate. They didn't rediscover that until the 1800s, when the germ theory of disease came in. They understood why the Romans had the sewer system and the water system that they did. Okay, define schizophrenia. Now, schizophrenia used to be called dementia praecox. Which meant early dementia. There was senile dementia, old-time dementia for old folks becoming demented, and there was early dementia. And schizophrenia was dementia that came on at an early age. A typical picture, especially in males, was that the person seems normal till they get to be about 18, 19, 20, and then they may have hallucinations, may have delusions. The hallucinations may, that's hearing or seeing things that aren't there. Hearing voices is very common. Typically about 18 years old. And this is more characteristic perhaps of males and females. That at around the age of 18, the person may become withdrawn, so they begin separating, maybe stop going to class. If you know 100 people in high school or in college, you probably know somebody or will know somebody. About 1% of the population, some people think as high as 2% of the population has schizophrenia or will develop schizophrenia. Cognitive slippage. So the person's thoughts don't fit together. One idea goes to the next in a way that doesn't seem to make sense to people, like gears in a machine that don't fit together. Word salad. Sometimes the person's, what they say doesn't seem to make any sense. You saw in the video a little passage where the person is saying, then Kashmir came and Kashmir's spirit was separated from her, and so on. You may have a split between emotion and affect. The person is tearing out their hair and crying, and you say, "Are you unhappy?" And the person says, "No." "Well, why are you tearing out your hair?" "Because it belongs to my father." You know? "I don't know why is a monkey." "What do you mean, why is a monkey?" "A three-wheeled bicycle, because ice cream has no bones." So those are some of the things of schizophrenia. And you saw some in the video, you saw some people diagnosed with schizophrenia. All right, hopefully you did not put multiple personalities residing in the same person, or split personality. It has nothing to do with split personality or multiple personality disorder. The term sometimes is misused in the media in this way. We have something called multiple personality disorder. Sometimes they call it dissociative personality problem disorder. The idea of a multiple personality disorder is you have multiple personalities residing in the same person. This, unfortunately, is all too common, maybe 1% of the population. This over here is more than 1% of all television programs, but some people argue there is no such thing. It's just something that people write books about. The movie Three Faces of Eve, the story of the Hillside Strangler is famous for multiple personality. Do you guys know the story of the Hillside Stranglers? Well, the Hillside Stranglers had seen enough movies about, well, what's the idea of multiple personality disorder? Well, that's that there's more than one personality in the same person. So, who am I talking to today, the psychiatrist says. And the person says, it's just me. It's always been just me. The person writes down, okay, that's another personality, just me. Who am I talking to today? I know the Hillside Stranglers, they got him, and the person says, I'm not guilty. It was Bad John that did the killing. Who's Bad John? I'm Bad John. I'm the one that kills the people. Yes, I'm the one that does that sort of thing. I'm the strangle people and kill them. Are you still there, Bad John? No, I'm back to the normal person. I'm a sweet, nice person. They brought in a skeptic. You read about this in the book already, probably. They brought in a psychologist who says, usually in the case of personality disorders, there's more than two. Usually when there's something bad, like Bad John, there's a female one. Oh, hi, no, I'm the female one. I'm Betsy. So each time the skeptical person said, this is usually what's the case in multiple personality disorder, the person who was copying the plea wanted to get off on a plea of insanity and get not sentenced to jail. Displayed the new symptom. So this one is a dubious category, but it's in the movies because people love it. So there's Sybil, The Three Faces of Eve. There have been a lot of movies based on it. Psycho, based on this idea of multiple personality disorder, the old Alfred Hitchcock classic and the remake, based on multiple. So there's lots of movies based on that. But this one is all too real. This one over there is more dubious. People argue about it. Psychiatrists sometimes write up books and then the patient claims that it was just me all the time. All right, any question about schizophrenia? You could have paranoia and schizophrenia. What's paranoia? Well, paranoia is, what are delusions? Hallucination is seeing or hearing things that aren't there, that other people can't see. Delusions are irrational ideas. So it has to be also false. Not only irrational, but irrational and false. So if you think that Dick Cheney is bugging your telephone and listening in on your computer and keeping track of what you're doing on the internet, you know, and it's not true, an irrational person wouldn't be afraid of it. Why, that'd be a delusion. On the other hand, if he is bugging your phone and listening in, why, then it wouldn't be called a delusion. So it's a false idea that's irrational. If you think you're the reincarnation of Napoleon and you're not, then you're having delusions. So paranoia is characterized by delusions, not hallucinations, but delusions of grandeur. And persecution. It sometimes gets misused. So if you hear somebody say, I'm paranoid of elevators, they're misusing the word. What they want to say is, I'm phobic. So the term, where the term schizophrenic sometimes gets misused when people mean multiple personality disorder, paranoia sometimes gets misused to refer to phobias. And phobias are quite real. Phobias are irrational and excessive fears. And there are lots of different kinds of phobias. Agoraphobia, there's something dash phobia, so hydrophobia. Well, aquaphobia is fear of water. That's when you've been seeing the movie Titanic too many times. Hydrophobia refers to rabies, so that's an exception from the usual pattern. And it's the case that dogs with rabies won't drink water when a normal dog would. They're frothing at the mouth, they're panting, they look dry. Normal dog, if it's healthy, it'll go drink water. But these dogs don't go drink water because they're suffering from a brain disorder produced by a virus, one that actually was studied by Pasteur. But other phobias like agoraphobia agoraphobia is fear of the marketplace, and so an agoraphobic is somebody that might be stuck inside their house. This one typically has an onset around the age of 20. There are some videos, I don't remember if, I think there might have been a simulated case of an agoraphobic being treated and where they were trying to help a person come out of the house. There's a video that I sometimes show when we have time of a guy who's trapped inside he's in his 30s, he's trapped inside the bathroom inside his parents' apartment. They leave a food tray by the door. He opens the door and takes in the food tray and then puts the tray back out in the hall. So what's going to happen when they die? So he's afraid to leave the bathroom and stuck inside there. The word agora refers to the marketplace, so the outdoors. A person's afraid of going out into the outdoors where something bad might happen. Rodentophobia is fear of rodents or rats. Pyrophobia would be excessive fear of fire. And there are also some terms like manias. So things ending in phobias, these are irrational fears. Manias, and some of them are philias. These are sexual paraphilias, are sort of unusual sexual attractions. So a misophiliac is a person who's sexually aroused by filth, used tampons or excrement or things like that. A pyromaniac gets a thrill out of setting fires. So things ending in manias. There's also some isms for some of the sexual paraphilias. There are about 200 of those different kinds of philias. I'll say a little bit more about them. Any questions about the quiz? Koch's criteria for the germ theory of disease, the definitions of schizophrenia, the definition of paranoia. A person could also be a paranoid schizophrenic, which means they may have delusions of grandeur, but they're also schizophrenic, and so maybe they see and hear Martians, they hear voices of Martians talking about them. The Martians are planning to get this person and take them to another planet for some reason. So that would be a paranoid schizophrenic. The movie A Beautiful Mind was a fictionalized account of a true person who had won the Nobel Prize in economics and was a paranoid schizophrenic, although they fictionalized the story, changed things around to make a better movie. Starred, what's his name, the guy from Australia, Russell Crowe. You may have seen that a few years ago. All right.